Hello, it's another quick episode of Let's Chat Health Tech. And this time I'm going to spend a few minutes talking about two specific things: the upcoming book series that you can expect here in the next couple of months or so, and then also the podcast and the next season of Let's Chat Health Tech. So first, with regards to the book, you may or may not know that I wrote Salescraft quite a while ago. And what I've done in this next series of books, it's 3 books, as the way it's being envisioned, is around fundamentals, process, and advanced are the 3 different categories. And what I've tried to do is collect specific sales tips and sales advice and ideas and prompts and so forth that kind of help founders and salespeople and health tech execs be more effective in terms of sales. It's very practical. It's very hands-on, specific examples. And the idea is they're like short bites that you can very quickly absorb one at a time and whenever you want. And you can also, these are books that are going to be easy to read and easy to share. And so what was the catalyst for all this? And it's like, I spent a lot of time working with health tech founders and execs and salespeople. And I find that they're like lots of little things that they could be doing that would significantly improve the level of effectiveness they have with their customers and prospects, that would give them more confidence, that would allow them to qualify better, that would allow them to add more context and richness to the conversations and just make them just overall more effective. And so I thought I'd create this as a series of books that are simple and easy to read and quick, given the attention span and all the things that are, media and all the things that are coming at us. I thought this would be a easy way and very absorbable way. And, if you've read anything by, say, Derek Sivers, for example, short books that are really consumable and yet impactful, that's kind of what I'm aiming for. So you can expect that, and you'll see in the near future, putting some things together that will allow you to actually see how the book's being formatted and, some of the tips. And if you subscribe to the newsletter, you'll see some of the tips woven into the various posts that I put together. And so that's the idea. And who's it for? It's for anyone that's looking to advance their sales, that's looking to just do better in terms of engagement with their prospects or their customers, or with current customers from an account management standpoint, because these things are universally helpful. In fact, they're probably just as helpful with your relationship as they are with your sales opportunities. So that's the idea behind the book. It's called Salescraft Fundamentals, is the first one that will come out. And you can expect that here in the next month or so. As those updates and examples come out, I'm eager to get any feedback that you can share and ideas, enthusiasm, or what have you. The other thing I wanted to talk about briefly is the new next season of the podcast. And there's going to be a little more of a theme that's going to be focused on health tech. It's going to be more about how to think in terms of sales execution in a very meaningful, almost wonky sense. And that is one of the things you'll hear me talk a lot about is the importance of not just knowing how to sell, which is the fundamentals book and the ones that come after, but you really have to understand how to communicate in a very meaningful, detailed way about how a health plan or health systems business is operating and be able to come to the table with very specific ideas. I've got some of my own I'm going to be sharing in upcoming posts that I think are both provocative and I think indicative of where I think healthcare is going in some meaningful ways, and specifically from a sales standpoint. The guests will be a number of really good guests. I'm dragging in some folks from the most recent TechStars cohort, so we'll get some really interesting perspectives from those folks. We've got some people that are experienced in sales operations and in business operations, but again, with health tech companies and so forth. And, I'm going to try and get a cross section of people from health plans and hospitals, health systems, and then, of course, health tech companies themselves. I have a philosophy that is, don't let the perfect be the enemy of the good, which is to say, let's get it out there and let's get going and let's get the message. And I think that's served me well in the whole, but as we come to the next season, we're going to elevate it in terms of its production values, which I think a bunch of you will appreciate. So with that in mind, that's what I have in store. I just thought I'd give you a quick update on what to expect. And as always, encourage you to email me. And if you've got specific topics you want to cover or problems or, like sales opportunities or sales issues or other things that we should cover, I'd love to hear them. Thanks again. As always, thanks for listening and look forward to seeing you in the next episode.